Today we're going to be discussing what families should look for once nursing homes reopen after the pandemic ends. My name is Barry Doyle. I'm a lawyer in Skokie, practicing nursing home abuse and neglect work throughout the state of Illinois. I'm also the author of Built to Fail, a free report available for download from my website, which spells out how the nursing home business model inevitably results in unnecessary injuries and deaths for nursing home residents. As we're recording this, today is April 6th, and nursing homes are beginning to reopen after having been closed to families for the better part of a year due to the COVID pandemic. One of the things about this is that it's been very difficult on families. I have a father who's in a nursing home myself, and I went several months without being able to see him. And I can't tell you the number of families I've spoken to where they're really upset about their inability to visit with loved ones or communicate with them in any kind of a meaningful way. And they have real concerns about the impact of that on the care that they've received. I'd like to say that the COVID pandemic isn't going to have any real adverse impacts on care, but I really believe that that's going to be the case. Nursing homes, under the best of circumstances, are businesses that are really stressed to provide the necessary care that residents require. And with the pandemic, with the difficulty in staffing nursing homes, in the additional steps that need to be taken to try to keep residents safe from COVID, those difficulties have just been multiplied. And as families are able to enter nursing homes and see loved ones once again, I really believe that there are going to be a number of discoveries that families are going to make about some of the inadequacies in the care that their loved ones received. These are some of the particular areas that I think families need to be concerned about and need to be looking at. One of them is the development of bed sores or pressure ulcers. Bed sores or pressure ulcers develop from three main risk factors. One of these is immobility, the second is incontinence, the third is poor nutritional status. When we're talking about immobility, this is the inability of residents to turn and reposition themselves in bed or in a chair. As a result, they're exposed to extended periods of pressure over the bony prominences, which causes breakdowns in skin. Due to the fact that nursing homes have difficulty meeting the care needs of residents under the best of circumstances, my suspicion is that many families are going to find that their loved ones hadn't been turned and repositioned, and as a result were at increased risk of developing bed sores. And I suspect that we're going to find that many residents have suffered really significant bed sores as a result of not being turned and repositioned the way that was really required. Incontinence is another risk factor that leads to the development of bed sores. All that is required in this regard is that residents be changed after having episodes of incontinence, whether it's of urine or feces, for the same reasons that turning and repositioning is more difficult in the context of the pandemic. Providing proper incontinence care is also something that's going to be a matter of increased difficulty for nursing homes. Finally, poor nutritional status is another factor that plays into the development of bed sores. I suspect that what we're going to find is that many residents have developed some degree of depression due to really the unrelenting isolation that's required to keep people safe from COVID. And one of the ways that this is going to manifest itself is in decreased appetite, lowered oral intake. In other words, they're eating much less because there's a mood disorder, but also because the staff simply isn't available to help residents eat. So all of these factors are going to be things that ultimately will play into the development of bed sores. A second area where I suspect that we are going to see consequences that are associated with COVID is with weight loss. And I sort of explained why this is the case. Simply, residents will experience decreased appetite due to mental health conditions associated with all the isolation due to COVID, as well as the lack of assistance from the staff. Another area where I think we'll see increased problems for nursing home residents is in the development of contractures. In other words, the inability of residents to straighten out limbs and use them in a normal fashion. And this is simply due to a lack of exercise, a lack of assistance with range of motion from the staff. These are things that are often preventable due to range of motion programs that are performed in normal times. Many times I think that these will go by the wayside in a COVID type environment. Finally, I think we'll also see that many residents have experienced more significant falls than families are aware. Nursing homes are required to notify families when falls occur. And the problem with falls is that oftentimes, these really do have significant adverse effects in terms of their overall level of function, even if there isn't a significant fracture like a broken hip or another serious injury like a brain bleed. Many times residents will have significant losses in function that are associated with the falls. When families aren't able to see residents, these are things that aren't going to be apparent from the interaction that they have with the staff over the phone. So these are all areas where I think that as nursing homes open up again and families are getting access to their loved ones, we are going to see the results of poor care that happened during the pandemic, which are a product of the pandemic, but not necessarily something that is directly COVID related. I hope you found this interesting. If you have any questions regarding this or any other nursing home abuse and neglect matter, please feel free to reach out to us. Our number is 312-263-1080, or we can be reached on the internet at www.accidentlawillinois.com. Thanks for watching.